Andrews. I'm a BSN student at Northwest Florida State College. This is my volunteer presentation on the St. Andrews Community Medical Center. The St. Andrews Community Medical Center is a not-for-profit clinic. They provide volunteer health care to the economically disadvantaged and uninsured persons of Bay County and surrounding areas of Panama City. They provide free prescription medications. They have their own pharmacy with donated medications and pharmacists that distribute those. And they also have a patient assist program which assists patients with obtaining the more expensive medications directly from the distributors that they do not get donated. At the St. Andrews Community Medical Center, they currently have 170 volunteers registered, 70 of which are licensed. They have physicians, nurse practitioners, nurses, and pharmacists. Some of the physicians, they have ER doctors that come, pulmonary specialists, cardiac specialists, nephrologists, and also GI specialists. And then those doctors will also, they have some that they consult out of the office if they need to for other specialties. Since opening in 2004, the St. Andrews Community Medical Center Clinic volunteers have donated over 110,000 hours and also given $20 million of free health care to the Bay County citizens and others from surrounding areas that qualify for their assistance. Some of the nursing skills that we use during volunteering at the medical center include triaging patients, taking vital signs, administering medications, and they also do finger stick monitoring for the glucose and as well as INRs. During the triage phase, you obtain the patient's history, ask about any problems they're currently having, and also get a current medication list for when they're seen by the doctor so they can go over it and make sure of any changes they might need at that time. Do a full set of vital signs, also administer any medications that are now orders that the doctor might order for blood pressure or if their sugar is high or for pain or nausea while during their current visit. They also do the glucose and INR monitoring with just the finger sticks. The INR is done for the patients on Coumadin therapy to monitor their dosage, and it depends on their levels, depending on if they have a valve replacement or for AFib. And they have a actual sliding scale that they keep up with, and they adjust their dosage from that. Here is with anywhere else you have to work as a team to get anything done. Some of the things that the nurses do, they assist the physicians or nurse practitioners, and also they help fill prescriptions. They'll help the physicians, nurse practitioners. They'll assist with some simple INDs if the ER doctor is there. Also, sometimes they'll do simple dressing changes. They also help fill the prescription. They'll help the pharmacist and the techs to get the prescriptions done because the patients can only come on certain days of the week to get them filled, and therefore, just for time management, they have to help out and do that to get everything accomplished. Effective communication skills are also important, as with any other office. You have to discuss the patient's plan of care with the physician and nurse practitioner. You also have to let them know if you have any abnormal vital signs you find during the triage, or if you're doing their INR or glucose testing, checking to see if those are high or low, and so they can adjust their medications appropriately. You also want to make sure the patient gets appropriate follow-up. You'll need to follow up with the patient as well as liability. I've already went over the nursing activities pretty much that are done at the clinic a few slides ago as far as triage, vital signs, and filling prescriptions. As far as liability, they have the Volunteer Protection Act, which I think is pretty much for every state, but it protects volunteers from being sued if practicing in a nonprofit organization as long as you are acting in good faith within your scope of practice.